Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes. Subscribe the channel if you have not, especially if you are a nurse. For OET, for NCLEX, for NOSET, this channel is something that would be very valuable for you. And today we are trying to cover OET speaking. So I was just saying OET speaking, see, first of all, please try and understand everyone. Speaking is the easiest thing that we can do. I understand if you're coming from your regional backgrounds, Hindi, Punjabi, or maybe from Malayalam, Tamil, Telugu. Sometimes, we are in a habit of talking in our own languages. Once we start trying, it becomes easier. But we need at least a try of 1 to 2 hours a day. That's it, only 1 to 2 hours a day. And when it comes to OET speaking, then though it's 1 hour a day is more than enough. OET speaking is all about practicing the same thing every day. So if I say, good morning, my name is Bhupesh. I am a registered nurse over here. So if you are standing in the hospital, you will say, how may I help you? That is what you normally do in your daily. OET speaking is all about practical things. So good morning, my name is Bhupesh. I am a nurse over here. How may I help you? Even registered word is not important. Sometimes words like this confuse you. They don't let you become the real nurse. So please focus on the practical part. Good morning, my name is Bhupesh. I'm a nurse over here. How may I help you? Well, nurse C, I'm not feeling well. Okay, in that case, could you please tell me what is bothering you? So that is how you do that. That you simply ask, what is that thing? What is bothering you? Then patient will say, nurse, I'm having headache. I'm having multiple problems. Okay. Could you please tell me more about your symptoms? Then patient will say, I'm having this symptom. I'm having that symptom. So you say, okay, that's fine. I have noted your symptoms. Now, if you have any other extra question, so you will say, I have noted down your symptoms. So now I need to ask you some questions. Simple. Now, please, when you are new, suppose if you are not speaking English often, then when you are starting your role play, one day should be given only to intro part. Means we feel better when we speak something nicely. So if you are a beginner in OET speaking, just practice this much part. Speak it again and again, record it. Speak, record, and then listen to your own recording. Improve it. Speak like a professional. Practice again and again. So, Barbar, good morning. My name is Bhupesh. I'm a nurse over here. How may I help you? Well, nurse, I'm having this. Don't worry, I'm here to help you. Could you please tell me what is bothering you exactly? Okay, okay. Could you please tell me more about your symptoms? Okay, that's fine. I have noted your symptoms. So now I need to ask you some questions. May I? So the patient will get extremely happy. May I? Of course, nurse, you can ask me questions. Thank you. So now you ask your questions according to your task. Thank you. Um, could you tell me? Simple again. Could you please tell me? Now, major word is do. Do you smoke? Do you drink? Okay. How many cigarettes do you smoke in a day? Simple. And now write it. Write it with your hands and practice it again. Record is the main thing is recording your own voice. Even when I listen to my voice, sometimes it's not perfect. So when I listen to my voice, I feel like I should improve more. So that is how things happen. So record your voice and don't do everything in one day. The problem with beginners is that they want to complete the roles, OET role play in one day. See, you have to break every big thing into pieces if you want to achieve anything big. Climbing a Mount Everest, bits by bits, step by step. take break, master what you have learned. So you should master first intro part and asking questions and speak it as fluently as you can. You will see, you will start believing that you are changing. That will give you confidence. And in speaking, confidence is everything. Everything. So speaking is all about confidence. But for that, if you do everything, if you will just do, oh, teacher ने आज role play करवाया है, आज मेरे को पूरा करना है, then you will be in trouble. And see, if I tell you the intro part and question part, you will see, oh, do you drink? Do you smoke? How many cigarettes do you smoke in a day? How much do you drink? Simple. How much do you drink? So that is how you learn. Then, if you want to ask anything about the past medical history, do you have any past medical history? Okay, okay. I'm noting it. And do you have any family history? See, so good. Do you have any family history? All right. Okay. Thank you for answering my questions. Questions. This will help me or doctor. This will help doctor a lot. This will help the doctor to make the right diagnosis. If topic is like that, means talk practical. Why explain to the patient. Otherwise, if you don't want to speak this line, it will not create any fuss. Speaking is all about whatever you are speaking, speak it nicely. So the problem is that we try to learn so many things, but we don't speak it nicely. Speak only that thing which is easy for you. Again, again, the same thing that we did today in the reading class. Would you like to lift a pen in the final exam, or would you like to push the wall? Pushing the wall wastes energy. Picking a pen gives you marks. That is what OIT speaking. Whatever you speak, speak it nicely, fluently, confidently. That is what gives you marks. So thank you for answering my questions. This will help the doctor to make the right diagnosis. Now I need to examine you. Is it okay? Take permission. Patient will say, yeah, nurse, it's okay. Thank you for giving me consent. Let me examine you. Speak these lines because in OIT, you cannot demonstrate anything because it would be only audio recording that would be going to the examiner or who will be giving you marks. So let me examine you. After examination, always remember these lines. You have to speak this line every time. After examination, I have found that you are having. Now, according to your task, whatever the patient is having. So this is how your role play go until the examination part. I will repeat it again rather than again. I will not do the same mistake which normally all the beginners are doing. I won't teach everything in this day. So this is very easy. You can learn in one day only, but you have to divide. Good morning. My name is Bhupesh. I'm a nurse over here. How may I help you? Could you please tell me what is bothering you? But if he has told I'm having headache, then you can't speak this line. How may I help you? Then he will say I'm having headache. Okay. So could you please tell me more about your symptoms? Okay, that's fine. I have noted down your symptoms. Now I need to ask you some questions. May I? Okay, thank you. Could you please tell me, do you smoke? Do you drink? Okay, how many cigarettes do you smoke? How much do you drink? Do you have any family history related to the same kind of problem? Okay, do you have any past medical history? Any other problem that you are having? Okay, okay. I'm noting it. And this you will speak in between because it is a present continuous tense. I'm noting it. Then you ask another question. All right. Thank you for answering my questions. This will definitely help the doctor to make the right diagnosis. And now I need to examine you. If you don't mind, is it okay with you? Can I examine you? Okay. Thank you for giving me consent. Okay. After examination, I have found that you are having this and that thing. That is how you go to half of the role play of OET. Please practice it, record it if you are a beginner. Speak it just like me. Become the most efficient person. Just do half, but do it like wow. This is Dr. Bhupesh from Dr. BKM Institutes. Again, telling you the real secret. Do less, but do it perfect. Quality is everything in today's world. So if your voice has quality, it has confidence, you will definitely get good marks. Again, this is Dr. Bhupesh. Subscribe the channel if you have not for the best OET, NCLEX and NOSET tips. Thank you very much.